Study Designs in Pharmacoepidemiology Cohort Study, Part 1. Learning Objectives. Understand the basic concept of cohort study. Learn how to select comparison groups in cohort study. What is cohort? Cohort is an ancient Roman term applied to a band of warriors that work together. So it's basically a term refers to persons banded together, group of persons with a common statistical characteristic. For example, they have the same age, they have the same birth date, and they are going over time together.
إن شاء الله مشت الأمور المرة
Cohort studies. They are characterized by being longitudinal design, so it takes long time to obtain the outcomes. Prospective studies, most of them, they are famous for being the only design that can be performed in prospective way in order to obtain the outcome in the future. Forwarded looking studies, so you start at the exposed and you look forward for the outcome. Incidence study. It's a synonym with incidence studies. Historically, cohort studies are used to calculate the incidence of outcome in exposed group. Start with people free of disease. This is the main difference between cohort study and case control study. Case control study start with diseased patients. So we choose the cases as diseased, the controls disease-free, and we go retrospectively to assess the exposure. However, in cohort study, we start with people free of disease. Assess exposure at baseline. So we assess the exposure at baseline and assess the disease status at the follow-up. So we put certain time for follow-up. At the end of this time point, we identify the outcome or the disease of interest. Cohort studies. The theme, we start with population at risk, measure characteristic at baseline, follow up the population over time with a surveillance or re-examination profile, compare event rates in people with and without characteristic of interest, for example, the exposure. So we assess the exposure at baseline or the level of exposure, not necessarily the sample could be classified as exposed or not exposed. They also can be classified based on the level of exposure, and we assess the difference in the occurrence of outcome at the end of study. So as you can see, it's a forward directionality. So we start with exposure, assessing exposure levels, and we compare the outcome or the disease at the end of follow-up. So it's basically very similar to clinical trial design, where you start with the exposure. You have exposed, not exposed, patient taking intervention, patient taking placebo in clinical trials, and you follow up the patients to a certain time point when you can assess the outcome. However, the main difference is that clinical trials are experiments. They are randomized, double-blind clinical trial. However, cohort study is an observational study. There is no control on the intervention, no control on the exposure. However, in the clinical trial, it's an experimental design. Elements of cohort study. We select the study subjects, obtain data on exposure, select comparison group, follow up, and finally conducting selection of study subjects. We can choose the study subjects of the study either from general population or from special group of population. So we could start with whole population in an area, which sometimes could be extremely difficult to obtain the whole population in certain area. So we rather select a representative sample from this area. The second option is to start with specific groups. For example, we start with selecting groups based on occupational status or professional status. For example, we compare the cohort in among students, cohort of physicians, cohort of nurses, says cohort of diabetic patients, or we choose the groups based on the exposure. For example, person having exposure to some physical, chemical, or biological agents. For example, we choose radiologists because they have exposure to X-rays. This is one example. Obtaining data on exposure. How we obtain data on exposure? This could be by personal interviews or mailed questionnaire. So we send or interview subjects and ask them about certain exposure. Or we can review their records. So, for example, we go to the record of the patient in the hospital to review any information about dosing of drugs, radiation, type of surgery, or we can medical exam or do special test for the patients. So we take the blood pressure management, we take serum cholesterol levels, we measure HbA1c levels, we measure vitamin D levels, or we can have environmental survey based on, for example, exposure to natural gas, exposure to nuclear remnants, anything that can be identified on environmental level. Also, we can choose obtaining data of exposure. We can classify the cohort as exposed and non-exposed. So we start by selecting subjects, then we identify how we will measure the exposure, and based on this, subjects will be classified as exposed or not exposed. Selection of comparison groups. We can start with one option, which is internal comparison. So we have only one cohort involved in the study, sub-classified and internal comparisons done. So we can, within the same cohort, we have exposed, not exposed. Both groups are followed up over time, and then we have, by the end of the study, subjects with disease, subject without disease. This is one option, internal comparison. The second option is external comparison. So we have more than one cohort in the study for the purpose of comparison. For example, if we want to assess the level of X-ray exposure on a certain type of cancer, we can have a cohort of radiologists compared with a cohort of ophthalmologists, two different cohorts. The third option is comparison with general population rates. If no comparison group is available, we can compare the rate of study cohort with general population. For example, cancer rate of uranium miners with cancer in general population. Follow up. The third step is to follow up the subjects until the occurrence of the outcome. To obtain data about outcome to be determined, morbidity or death, we will also measure the occurrence of this outcome either by mailing the subject's questionnaire, telephone calls, or personal interview, periodic medical examination, reviewing records, surveillance of death records. Follow-up is the most critical part of the study. Why? Because this is what differentiates cohort study from all observational studies, and also this is what makes it a very strong evidence to refer to, because we start with subjects outcome free and we follow up them until the occurrence of outcome, eliminating many of the drawbacks of retrospective design or other observational designs. In general, you can't avoid the loss of follow-up in cohort study. However, this should not be exceeding the limits that's already assigned at the beginning of the study. Loss to follow-up is one of the drawbacks of cohort study in general.